Hi, we're going to talk about the neck today. We have some structures we're going to go over, and I will do my best to keep it clear and to the point. So we have an anterior view. So up here, superior, and then inferior, and left, and right. Number one is the hyoid bone. Inferior to that is the thyroid cartilage. And then inferior to the thyroid cartilage is the thyroid gland. So all these structures are in the medial aspect of the neck here. Again, most superior structure that we're talking about today is the hyoid bone. Inferior to that, thyroid cartilage. And inferior to the thyroid cartilage is the thyroid gland. The thyroid gland has a right lobe and a left lobe. The portion that connects the two is the isthmus, and it is right here. The thyroid gland is located around the second to fourth tracheal ring. So deep to this is a superior portion of the trachea, and then you can see here a more inferior portion of the trachea. Number 11 is the trachea. You can see the tracheal rings. And again, this is kind of the medial aspect of the neck. So we have the thyroid gland. Deep to the thyroid gland would be the trachea, and it would course inferiorly, and you can see it here in the trachea. Superior to the thyroid gland is the thyroid cartilage, and superior to that is the hyoid bone. So on the lateral aspect of these structures are the vessels. Here on the left side, the left common carotid artery, and lateral to that is the left internal jugular vein. So the internal jugular vein is lateral and posterior to the left common carotid artery. On the right side, same vessels, the right common carotid artery, and then the right internal jugular vein. The inferior portion of our image, we have the left subclavian vein labeled number 5, and we have the right subclavian vein labeled number 6, and it also shows the right subclavian artery posterior to the right subclavian vein. Number 9 is the brachiocephalic trunk. It's the brachiocephalic artery. It is posterior to the brachiocephalic vein, and if you follow it inferior, you're going to reach the aortic arch. So off of the aortic arch, posterior to the brachiocephalic vein, you can see the 3 branches of the aortic arch, the brachiocephalic artery, posterior there, the left common carotid artery, posterior again to the vein, and it follows up superiorly. We talked about it earlier, so it is coursing superior, and then lateral to that again is the internal jugular vein, lateral and posterior to the left common carotid artery. And to the left of the left common carotid artery is the left subclavian artery. It's hard to see. It is posterior to the vein, and it is going to course superior and then laterally just posterior to the left subclavian vein, just the left subclavian artery. On the right side, the brachiocephalic artery bifurcates and becomes the right common carotid artery coursing superiorly, and up here in the superior portion it bifurcates again, and I have it labeled here, number 13, the right internal carotid artery, and the right external carotid artery is number 12. So those are some important structures that we should keep in mind while we're looking at our cross-sectional images. Thanks.